Ramadan already. We were just awaiting for Roseh or Ramadan to start, and here we are into the third week and coming into almost the final run. So yeah, how time flies. As always, we've got fantastic lineup of guests today, and we've got two special guests, and you'll be delighted, and you're already aware who following Ramadan FM who they are. But it's going to be an exciting 1 hour with lots of questions. Now, you can join in. What we will be asking you to do is either you can listen to us on 87.9 FM, or you can text us if you have any questions on 07748 55055, or send us an email on info@ramadan.fm. Now, I'm not going to waste any time because I'm going to go straight into the show, because we've got a lot of exciting discussions, conversations, chats to go forward with our two iconic personalities. I actually feel really proud because, Pakistani Muslim, and, we have to celebrate when we have our own coming forward in such posts. So I'm going to go straight to introductions. So the first person that we have is Wasim Khan, who's the Chief Executive of Pakistan Cricket Board. And just as an introduction, well, he needs no introduction, but as a background, I suppose, Wasim was the first British-born Pakistani to be awarded a professional contract when he signed for Warwickshire in 1990. In 2013, he was awarded the MBE for services to cricket and community. He also sat on the Equality and Human Rights community group. He has his own autobiography named Brimful of Passion, which won the Wisdom Book of the Year in 2006. In 2018, he became the chair of ECB, the English Cricket Board, Men's Domestic Playing Group. 2018, he was named the Parliamentary Review Muslims 100 list. 2019, he was appointed where he presently sits as the Chief Executive of the Pakistan Cricket Board, and the success story continues. He was, mashallah, awarded in 2021, that's this year, the Wisdom List, 21 people who have shaped England cricket in the 21st century. Assalamu alaikum, Wasim, and welcome.
Wa alaikum salam. Thank you, Shahid. Pleasure to be here.
It's the pleasure is all ours. Our next speaker is also an iconic personality and another individual who we are hugely proud of. He's Dr. Zafar Iqbal, who's a consultant in sports and exercise medicine at Crystal Palace Football Club. He previously held similar roles at Liverpool Football Club and Tottenham Hotspur Football Club. Being an Arsenal fan, I didn't want to say that, but I have to say that it is Tottenham Hotspur Football Club. And I think Zafar will tell us, he's the only doctor to have been a doctor in 3 Premiership league clubs. So another accolade. He's the current chairman of the Premiership League of Doctors Group and co-chairman of the Football Association Medical Society. He's also a lecturer at the QMUL in Sports and Exercise Medicine, with interest in healthy lifestyles and promotion in the South Asian community. So Zafar, welcome to you as well.
Assalamu alaikum, and jazakallah for that kind introduction.
Wa alaikum salam, and the pleasure is all ours. So let's get straight into it. Wasim, let us hear from yourself. Tell us more. What a fantastic journey it's been. So tell us how it's been for you. I mean, I was listening to some of your interviews, and I do follow you. I mean, I listened to some of your interviews on Pakistan TV, etc. And I actually thought when I saw you first, I thought you must be around about 34 or 35, and I said, wow, this chap has achieved so much in such a short career. But you're slightly older than that, only just slightly.
Yeah, I turned 50 about 2 months ago. So
mashallah,
yeah,
you don't look 50 at all. You don't look 50. So Wasim, tell us, how's the journey been?
Yeah, it's been an interesting one for me. I started as a sort of a 13-year-old who got spotted in a school playground by a teacher. Took me for trials to Warwickshire, and growing up in inner city Birmingham. And really the journey went from there, and I played for all the age group teams right up to the age of 19. Got awarded a professional playing contract with Warwickshire at 19, and then played for England at 19s as well at the same time. And then, was at my sort of boyhood club, if you like, county for 7 years. I was lucky enough to play with the likes of Alan Donald and Sean Pollock and Brian Lara. I was at Warwickshire in 1994. Got a championship winners medal, and also a NatWest winners medal as well in 95 when we won the double. And then moved on to Sussex and then finished playing cricket in 2000. And I'd never been to a university, so I didn't have a degree behind me. I used to go to Australia for 6 months every year to go and play cricket there. Did that for pretty much about 8 or 9 years. Set up a little coaching school, went into schools in inner city Birmingham trying to give something back. Then got recruited by the former governor of the Bank of England, Lord Mervyn King, to set up something called Chance to Shine, which was about trying to get cricket back into state schools. So it's something that touched my soul because it was something that obviously I'd been founded through the school system, state school system. So it was something that was a passion of mine to get more opportunities for young people, but just as importantly, try and help kids develop through competitive team sports, which is what any team sport does. It helps you develop in terms of your character, your resilience, learning how to win and lose, all important traits in life. So I did that for 9 years. We raised over £50 million as a charity and reached about 2.5 million children. Wow. Across about 11,000 state schools. After that, decided at the grand old age of 42, I'd do a master's. So I did an MBA at Warwick Business School, having never really had any interest in academia, but I think leadership role just made me quite curious about various things that I could develop and learn. And so I did an exec MBA there for 3 years, got an MBE from the Queen as well for services to cricket and the community. Decided to write a book, which I did do as well, just about my experiences as a British Pakistani growing up in inner city Birmingham and making a way through. And as you said, it was Wisdom, Alhamdulillah, Wisdom Book of the Year in 2006. Then I got recruited to take over as CEO at Leicestershire, which I did for 4 years. And I think I was the only Black or South Asian across any professional sporting club as a CEO, which in itself was probably not a great stat for the industry. And then I got asked to apply for the role with the Pakistan Cricket Board in 2018, which I did do. And Alhamdulillah, I'm sort of 2 and a bit years on now, and I'm living in Lahore and enjoying life and enjoying the role.
MashaAllah. And the journey continues, and we will come back, Wasim, to talk about that experience and obviously amongst those other things as well. Zafar.
Thank you. Yeah.
Zafar, tell us about your journey. I mean, you've had a sort of a similar, I'm not aware of any other Pakistani in a similar role to yourself, Zafar. In fact, not only in football, I think, a similar role to yourself in any other top sport that I'm aware of. So tell us a little bit about your journey and how you ended up becoming a sports and exercise physician.
So I think, to be honest, my journey started when I was 2 years old, when my dad insisted that I was either going to be a doctor, chartered accountant, or a civil engineer. Yes. But my career choice was actually made when I was around about 10 years old, where unfortunately I had a sister who had brain cancer. And I think following the care that I saw her receive while she was in hospital over the next 6 years, really shaped my desire to actually be a doctor. So got into medical school, again, with my parents' support, got into medical school. And then I was going to go down the orthopedics route because I enjoyed fixing things from a very young age. My dad always made me fix things around the house because he felt that if I did get injured, I was more likely to survive than him. And I was going to go into orthopedics, but then I injured my knee. Like lots of Pakistanis, I enjoyed playing sport, mainly football. Injured my knee playing football, and I was told it was going to be 18 months to get an MRI scan, started gaining weight, started feeling depressed. And so I thought to try and find out how I could help myself. So I did a master's in sports medicine. And in the NHS, sports medicine wasn't really recognized as a specialty at the time. It was just a case of take some anti-inflammatories, apply some deep heat, and off you go. So I started setting up some sports medicine clinics, doing quite a lot of voluntary work to try and gain some experience. So I did about 2 to 3 years of voluntary work wherever I could. Restarted something called the FA Medical Society, which was a society to try and improve education and find best practice in sport. And it just snowballed from there. Started working with the England youth teams, with the FA. From then on, someone at Spurs had heard about my work and asked if I'd be interested in applying for the position there. So I worked at Spurs Academy, swiftly moved on from there to the Spurs first team. And then in 2010, I got an opportunity to work at Liverpool Football Club with Professor Peter Bruckner, one of the leading sports medicine consultants in the world. I'd only applied to Liverpool just to try and get a pay rise out of Spurs, but that wasn't happening. And 3 times I rejected Liverpool, and they eventually came back with an offer which I couldn't refuse. And then I had to tell the wife that actually I've got to move to Liverpool. So they stayed in London, and initially it worked out fine. I was commuting back and forth, but after 5 years, and when we got into Champions League, it was just getting too difficult. So I moved back to London, and I was asked then if I'd be interested in a position at Crystal Palace. And so this is now my 6th season there at Crystal Palace. And during my whole time in sports medicine, I've been constantly trying to improve education and awareness in sports medicine and really trying to find best practice. And here we are today.
Absolutely fantastic, Zafar. That's wonderful. We've got questions coming in already. Some of the questions are touching on some of the questions I wanted to obviously touch on. But let's start off. Obviously, it is something, maybe it's a good kickoff, I suppose. Wasim, the first question's for you, and then we've got a question with Zafar as well. So Wasim, one of the questions that's really come in, and I suppose it will be a good one to start off. The question is from a chap called a Spurs fan from Rochdale, and he's saying Salam and Ramadan Mubarak, and he's asking,
Salam.
With diet being important to sports performance and career longevity, how does the Pakistani cricketers' diet compare to other cricketing nations such as England or Australia?
I think vastly improved. I think that if you look at a lot of the Pakistani players now, there's a huge amount of time and effort that goes into their sort of diet and their fitness. They're a lot more agile than what they used to be. I think the challenge always remains within places like Pakistan is the lack of education when they go home, particularly with their families. But by and large, I mean, in terms of the fitness tests and various other things that the players do, the fat content, etc., of the players, it's the best it's ever been in terms of reduced numbers. So, we're on, I think I saw a stat that actually our players from a fitness point of view are fitter than the Indian players in terms of the various testings that we do, in terms of the results, some of the standards that are now used across most of the cricketing nations. So, we're getting there. I think there's like fitness and nutrition, there's a huge amount of education that is required with the Pakistan sort of team and the culture, because unfortunately the PCB, the Pakistan Cricket Board, over the years has sort of failed the players, because there's been very little invested in terms of educating these players. And you've got to remember, a lot of these guys come from villages, they come from uneducated backgrounds, so they've had to kind of find and feel their way as they've gone through. But what we're trying to do now from the age of 16 is to try, and we're implementing all of those at our National High Performance Centre now, which we've completely revamped. From the nutrition side, we've had nutritionists look at the menu that is provided for players. They take a real keen interest and a huge interest now in their fitness, and I think they've realised that they are actually athletes and not just professional cricketers. So I think from that point of view, look, there's still a lot of work for us to do, but we've certainly come a long way, I think, over the last few years.
Indeed. No, thank you for that. And it's we are going to touch further on that. And just talking about diet, etc., from a football perspective. I mean, I've been an Arsenal supporter from long. I remember Arsene Wenger coming in and bringing in a whole change into the Premier League. I mean, Zafar, you'll probably be able to touch more on that, and how that kicked off from the late 90s. So maybe you can slightly touch on that, along with a question, which is for yourself, Zafar, which is, what message could you give to secondary school children on how to pursue a similar career path to yourself?
So the first instance is I qualified as a doctor, and we all know that that in itself, in terms of the standards to get into university, it is a very competitive field. So that's the first hurdle, really. So making sure that you try and get some work experience. Your A levels are all geared towards trying to become a doctor. And then once you've qualified as a doctor, at the time when I was doing my training, there wasn't sports and exercise medicine wasn't a recognized specialty, and that's now changed. So there are specific training programs in sports and exercise medicine. But I think the first challenge is really to getting into medical school, and that's hard enough as it is anyway. So once you get into medical school, inshallah, from then on, as I say, there are set programs that you can actually do, training programs that you can do. But as with any field, it's not just about doing the bare minimum. There's also a huge amount of other experience that you've got to gain. And I gained that by doing lots of voluntary work. And I think that's what really put me in good stead. So I was doing things which other people weren't doing. And I think that's what probably made me stand out. I wouldn't say I was, the cleverest at medical school, but I was certainly one of the hardest working. And I then also thought outside the box and just tried to look at how I could improve myself to make myself stand out. Well, not so much stand out, but how I could try and provide the best care for my athletes and learn as much as possible. So wherever I've worked, it's about trying to provide the best standards possible wherever we can find them around the world. So that's why I really got involved in the education side as a chairman of the FA Medical side to try and really see what best practice is. And so even though it's Crystal Palace, it may not be one of the so-called big six clubs, but I'd like to think the practices and the methodology and the sports science and medicine that we use, it's equivalent to anywhere else in terms of practice that you'd find around the world.
Yes. Fantastic. Okay, I'm just going to go on to the next question, which is basically maybe Wasim to yourself starting off. In relation to athletes, I mean, you've already touched on athletes and nowadays cricketers seeing themselves as athletes rather than, as you mentioned, just cricketers. So in order to maintain that high standard at international level, and not just getting there, but staying there, wanting to become the best. So what kind of work do you think is required, Wasim? I mean, I'm asking you as an ex-cricketer and someone who's at the top of a board at the moment who wants to see Pakistan cricket reach the top. So from your perspective, strength, endurance, skills, etc., what's required for athletes to be able to maintain that? Diet, obviously you've touched on. What else is it that you feel that is required?
I think the key thing is that particularly with fitness, it has to become a way of life for players, and it can't just be something that players do in order to get through the next fitness test. So I think this has been a big thing that we've tried to instill, and trying to make the fitness sessions enjoyable and something that these guys can go away and actually want to do rather than feel they have to do in order to get through the next fitness test, I think is really, really important. I think that Babar Azam, for example, has already proven that having a real level of self-belief and a real clarity and purpose about where you want to go, allows you to kind of wake up every day and be absolutely focused, whether you go in the cricket nets, whether you're practicing, you're fielding, or whatever, to want to be the very best. So I think that, that level of self-belief is something that, again, we're trying to bring a sports psychologist in, as both you guys are aware, and thank you for your help with trying to help me to do that, so that we can actually start to develop the thinking of some of these players. Because when you, for example, talk about reflection with some of these players, go away and reflect, they actually aren't aware how to go away and reflect on performances, because it's a state of mind, it's an understanding of how to dissect information, how to then put it to use and then try and improve and get better. So, there's a whole piece that, we're almost building those blocks again to try and get these guys to think in a different way, because the talent is there. And, we've seen it. When our guys click and they perform, nobody can beat them. And we saw in the Champions Trophy final in 2017. But what we're trying to do is, rather than saying, look, let's just have this as a sort of a one-off and we'll celebrate it for the next 10 years, is how do we consistently improve the current players and the pipeline coming through, So they come through as almost the finished product as athletes when they come through, both from a mental skills point of view, but also their physical fitness, agility, mobility, all of the important things that you need in international cricket, and just as importantly, their self-belief, because it's a belief factor more than anything, which probably stops our guys from going out there, expressing themselves and wanting to be the very best in the world. You know, we've heard a lot about our guys succumbing to pressure. You know, in tough times, tough situations, you know, a lot of them don't handle the pressure very well. So, you know, it's trying to get that support for them so they can think that through, they can work that through, and have methods that they can use that will help them in those particular situations. Because the pressure, as you know, is only the pressure that you put on yourself and how you perceive a certain situation or a certain scenario. And it's the build-up of that, the expectation of a nation expecting them to deliver. And at the moment, the Indians do that a lot better than ours. And, you know, we've got to try and just keep improving that so that the fitness sits alongside the mental skills, the nutrition, all those important things that make up everything that comes with high performance.
Yeah, indeed. And as they say, consistency, persistency, and the maintenance of that is really important. And as they also say, big shots are only small shots that keep shooting. So consistency, keep at it. You know, don't let it rest on your laurels. I suppose these are some of the things which are obviously forwarded to players, etc. So similar to yourself, Zafar. So from a football perspective, I'm sure there must be a lot of similarities being athletes. So is that something similar? Is that the approach that you take as well? We will come to in a moment the mental aspect of it. Obviously, a special interest of mine being a psychiatrist. But from others, like Wasim has touched on, things like flexibility, agility, skills, etc. Is that something similar in Crystal Palace Football Club and beyond? Is something that you see similarly? What approach do you take?
Exactly. So in terms of to try and get the athlete to perform optimally in their sport, it's got to be specific for their sport, and that's one thing that you got to recognize. What may work in terms of gym work, strength work, endurance work in one sport may not necessarily work for another sport. So it's got to be specific. So you've got to have trainers, strength and conditioning coaches, physiotherapists who understand that. So it involves physical training, building up strength, whichever sport that you look at, it's those same factors that you just mentioned: strength, endurance, speed, agility, and improving those skill levels. And as Wasim Bhai has already touched upon, I have only had a little bit of experience of various athletes from various sports in Pakistan that have come over. The skill level is definitely there. It's about providing that consistency. And, you know, that's what I feel is the difference in terms of getting Pakistan in all sports, because it's shown in the past, you know, whether it be hockey, whether it be squash, you know, we've had world champions in those sports. I think what has happened now is that they've not had the consistency because they've not been given the tools to be able to help continue those skills and continue that training at the highest level. And I think that's where they've fallen behind other countries. And it's great that, alhamdulillah, at least in cricket, that they've got people like Wasim who recognize the importance of those. You know, you talk about the psychological preparation, that's a completely different area. But our whole philosophy and ethos from the sports medicine perspective is to provide all the tools to try and get the player to perform at the optimal level. So we do lots of screening. So as soon as the player comes into the training ground, we're doing screening to make sure that they're recovered properly, because that's equally important as well. And, you know, we look at the 5 main training principles. So that's overload, specificity to the sport. You've also got to progress. There's got to be progression. You can't just keep doing the same skill over and over again, because that can also lead to being stale. Variation and consistency. And the main different, again, factors that come in, so we work on aerobic, anaerobic, flexibility, strength, and skills. We look at what elements of those are required for the sport, and we try and focus on those. So, for example, in terms of a footballer, you know, it's important that they can run quick, they can do change a direction quickly. And so we measure those as well. So we have certain skills or stations that are put out, and we measure them on a regular basis, as well as the things that go across sports as well, such as in terms of certain strength markers, body fats. So again, all those things that, somebody asks, well, why is body fat important? And one thing that I always find interesting from cricket, you hear some of the old cricketers saying, well, wasn't how we used to do it, and it's a skill-based game. Well, the game has moved on. And it's the same in football. And I still get some managers who say, well,
Zafar,
why are you measuring
let's
in terms of
continue.
how much they run?
Zafar, let's continue from there, because we're just going to go for a short break,
Sure.
and we'll kick off from the same place. So we'll see you and return in the next few minutes. We've already touched on a few things like their journeys and experiences, and also touching on things like performance, etc., from a lifestyle perspective. Now, I'm just going to go to some questions. I've got a lot of questions, but I think it's important that we have good interaction. So, Ittishamul Haq, thank you very much for sending your question through. This is for Dr. Zafar. I have seen him a lot helping cricketers and other sports personalities. He has changed the lives of many, being dead at a dead end, going back to playing on the field. How does it feel seeing them return to the field and performing, Zafar?
Look, I think that's the same with any athlete. Doesn't matter where they're from or which sport that they're from. And it was the same reason when when I got my knee injury. I love my sports, and being able to do what you love is very important. And just the opportunity to be able to help anyone get back to doing what they do is what you enjoy most, and why we got into medicine in the first place. So alhamdulillah, I'm in a blessed, a very blessed position, having worked at where I have with some of the best and elite athletes in the world, and being able to use some of the best practices. So I have been, as I say, alhamdulillah, I'm in a very fortunate position with those that may not have access to those kind of facilities. So as I say, I've helped, various different athletes from different countries, not just Pakistan, but in football as well in Pakistan, and squash and badminton. And alhamdulillah, it's very rewarding, and it's something that you can't really put a price on. I remember one particular player that I was able to help, and they got back to playing in a competition. And I think the phone call that they gave me, having been able to return to that competition, was probably one of the best phone calls ever. I mean, you could have given me, X amount of money, and I don't think it will ever replace that feeling that you get from being able to help someone get back to doing what they love.
Yeah, absolutely, Zafar. And we got another question. Saqib Ghani. Thank you, Saqib, for calling. I know Saqib is a cardiologist working in London. So he's got a question. He hasn't mentioned, but I'm assuming this is for Wasim. And it's sports psychologist is a very good idea, as it's helped so many other sports personalities in recent years. If to start with, PCB employs a foreign qualified person, how are we going to cross the language barrier, which is so crucial in psychology, to accurately assess body language? And then he says, well done on the initiative, by the way, and says, P.S. if you need a sports cardiologist, I'm happy to offer my help with a smiley face. Over to you, Wasim.
Great. Yeah, look, I think it's, and I've discussed it at length with both Zaf and yourself around the importance of having an Urdu-speaking sports psychologist. And I think that in itself will be a challenge for us. Hence why we've tried to spread the advert far and wide, as much as possible, to try and locate a few that might be out there that'd be willing to come and support Pakistan cricket and come and live in Pakistan and help the national team. I think it's a must for us. I don't think this is going to work without having an Urdu-speaking sports psychologist, because of the sort of level and depth of conversations and information and working that's going to be required, that because of the language barrier, it would be a real problem for us, particularly with some of our younger kids at the under 16s level, national level, and coming through. There's a huge amount of work that needs to be done at that level, rather than just focusing on our national teams. We want the next pipeline of youngsters coming through with coping mechanisms and methods that they can employ when they play games for their national team. So look, it's not going to be easy. I'm hoping we've tried to advertise as much as possible, obviously, with all the listeners here. If you are aware of any sports psychologists that you're aware of, whether they're in the States or Canada or wherever they are, or the UK, that potentially that we could speak to, be interested, that we really need this element within our sort of national high performance sort of framework and our sort of system. We've lagged behind because we simply haven't had the resource. And, it's sad in many ways that, even with our chief medical officer role at the moment, we are looking sort of abroad potentially as well to find the very, very best people. And similarly, we're trying to do the same in sports psychology. So there's a real issue in Pakistan around specialisms in these sorts of areas. But the Urdu speaking element is going to be critical for us if we want this to be effective.
Absolutely, Vaseem. Couldn't agree with you more. And I know we've had those discussions.
Yeah.
As we say, in healthcare as well, we often have a look at things like in diversity, equality, inclusion, especially with recent events that have taken place. And there is a concept which we call cultural competence, which is very different from cultural intelligence, which is a bit like emotional intelligence, where it's focusing more of the lived experience and being able to understand what I see as, tape ball cricket mentality, understanding that culture of tape ball in Pakistani streets right up to the athlete and the top level. So it's really, really important to get that good understanding or have that cultural intelligence as opposed to cultural competence, which in my eyes is just like a tick box exercise. You sit in front of a screen, do cultural, module, and you're expected to be culturally fair with what's going on. So that would be a big challenge, I understand. But hats off to you for taking the initiative. It's really, really heartening to hear that. I want to move on slightly, and I want to talk a little bit more about what you both touched on. And I know we're talking about sports psychology. And I want to talk a little bit about confidence in players, in athletes, building confidence, self-esteem. And, both in cricket, football, or any other sports, we have players who are out of form, returning from injury, those who are being out of team for any other reason and having to come back into the team even if it's not injuries. And last but not least, this whole issue related to the pandemic and the COVID and the way that we've had to ask our athletes, our cricketers, our footballers to readjust themselves, especially with the the breaks in between, with the breaks with the PSL and the breaks in the Premier League early last year or late last year in the last season. So Zafar, tell us a little bit about, if you may, about this confidence and how, from a head of sports or a consultant in exercise, sports and exercise medicine, how do you manage players? Because there's two aspects here. One is, there's a saying in Urdu which says, dil ko pinjre se nikalna, and there's another one is, it's not just dil ko pinjre se nikalna, it's also pinjre ko dil se kaise nikale. So it's not just taking the the heart out from the cage if someone's stuck in there. It's also, how do you take the cage out of the heart if it's really deeply ingrained, but you got talent there?
So I think there's two parts to it. So from the sports medicine side, it's really important that you are able to give feedback to the player to give them confidence. So the way that we do that is by measuring. We can measure skills, we can measure physical parameters. So for example, if a player is returning from injury, that can be quite a barrier, especially if it's a long-term injury that a player, say for example an ACL, a ligament in the knee, and they can be out anything up to over a year. So them returning to sport, how do you give them confidence that they're ready to return? Because they've got the physical element, but also the psychological element. So from the physical element, we will do lots of measuring. We'll give them feedback. So, we're measuring their strength, we're measuring their speed, and constantly giving reassurance to the player that, look, you're hitting the markers that you would normally be required to be able to return back to training. And then when they do return to training, we'll give them additional confidence by, instead of stepping up straight into a Premier League game, they will do under 23 games. So there's a stepwise approach at each time, going back to the player, making sure that they're confident and also making them feel part of the process as well. So that really is important, because you'll find most athletes, and I'm sure Wasim will agree, they just want to play, but sometimes they're also scared of telling you truly how they're feeling, because they're worried about their position, they're worried that the manager, the coach. So even though they may not be 100%, they'll say, yes, I'm fine. So I think it's really important that you try and get as much feedback from the player, but with trust on your side as well. Constant reassurance. So again, when a player is returning from injury, we're doing lots of questionnaires with them. And then from the psychological aspect, the questionnaires also ask that as well. We'll ask them, do you feel that you're ready? Do you feel you have confidence in terms of twisting, turning movements? And moving on, same with regards to, from the COVID perspective, what was really important before players could return, we had to reassure all the players that their health was the number one priority. Their safety was number one. So we gave, before they actually returned to the training ground, the manager, myself, the chairman, Steve Parrish, we would be on regular Zoom meetings, constantly reassuring the players that we had gone out to try and find what best practice was out there, and that we were going to provide them whatever tools that they need, whatever healthcare measures that they need to make sure their safety wasn't going to be compromised. And the players took that on board. That, in turn increased their confidence, and so allowed them not only to return to training, but also when it comes to returning from an injury, allows them to perform better. And players are competitive beasts, so you look at getting feedback, they always want to improve. So even something as simple like a jump skill. So, we'll have how high somebody can jump or how quick somebody can run. And we'll have a league table in the gym which shows who is at number one position. And all the players will constantly try and fight to try and, be in that top three. Similarly, when we do body fast, it literally is name and shame. So anybody who has got an excessive body fat, then they have to come in and they have to do extra CV sessions, extra cardiovascular sessions, try and get rid of that body fat. So in essence, lots of measurements, lots of feedback, lots of reassurance, and keep asking the player, because they're the ones ultimately that are able to give you that feedback, and they're the ones that are ultimately able to say that they're ready.
Excellent. A lot of work indeed. And Wasim, similar to yourself, I mean, from a confidence building perspective, when we do talk about sports psychologists, inshallah, exciting times ahead. There's one element which I always experience whenever I go back to Pakistan, because there's so much work that can be done there, and that's the very word, using the very word, depression, anxiety, nafsiyat as we call it, which can be seen as a bit of a stigma, especially for well-known household names. I mean, they don't want anything attached to that at all. So how do you? I mean, number one is building the confidence and self-esteem and overcoming anxiety. But the next step is, how do you feel in your experience, having lived in Pakistan, worked with top athletes, can you manage that? Number one, managing the issue itself, but also bringing the athlete on board to be able to discuss it openly.
I think, I think you sort of hit the nail on the head. It's always been a taboo subject, I guess, right throughout South Asia, not just Pakistan. It's a classic case where, when people talk about depression, and the classic case is, what have you got to be depressed about? You've got this, you've got that, you've got everything you need. We hear it in our sort of households. I've been in Birmingham, where a lot of my family are. You have similar things which are said to people who are actually going through that, and what they don't recognize is that it's actually an illness. It's not a choice. If you're going through that sort of depression. And so, it's just trying to, I guess, Zaf spoke quite a lot about, best practice. It's trying to, I guess, speak to the players quite a lot about what other players are doing around the world, so that, they can see the very, very top athletes and the cricketers who are successful, and some of the methods that they're employing. So, it might be, for example, the fact that, Virat Kohli uses visualization, a lot to help him. And therefore he's employed his own sports psychologist to help him do that, in terms of supporting, his methodology, how he goes about his business, his thought processes, etc. And it's trying to get this across, and this is something I've spoken at length to Babar Azam about as well over the last couple of years, is try and pick the brains of the likes of Virat Kohli. And it was only recently that he mentioned about the fact that, he spoke to Virat Kohli, and Virat Kohli says, when you go into the cricket nets, treat it as though you're walking out to bat in the middle, so that you're going in with a real clarity of purpose. And, Zaf will know from football that I can't imagine there's one wasted training session, because they're so meticulously planned, and whether it's set pieces or whatever they're working on, everything will be meticulously planned. So it's trying to bring that level of professionalism, whether it's short, sharp, intense work, you might be fielding drills, whatever, but doing it at an intense level where you're actually pushing yourself, you're competing, you're wanting to get better, in terms of, once you leave that session, you can understand, well, I set a couple of goals. These were my goals before I started the session. This is what I achieved in it. getting these guys to think this way rather than just, well, we'll go through the motions and we'll be okay when we come to competition and actual match play. So it's just changing the whole perception, getting these guys thinking professionally in every possible way. But the confidence thing is quite an interesting one. Having played cricket as well, it's the environment is a very vulnerable one. And Zaf will see, Zaf will end up being a therapist, no doubt, a lot of the time to a lot of players, because they want to talk about their vulnerabilities, the things that are going through their mind, and they're looking for a bit of an outlet. And even when you're playing, you're in a competitive squad system where actually you want people to fail, because if people are failing, then it gives you an opportunity to play, and that's that competitive instinct. A couple of bad performances and your confidence goes right down. You start to doubt your ability. Suddenly you're not in the first team, and the coach isn't talking to you as much as perhaps he's talking to the first teamers. That has an impact. There's a number of levels of vulnerability that seep in. People talk about ego, and yourself, Shahid, will know better about ego, but a lot of the time it's like a false confidence. Where it doesn't actually, there's a lot of bravado, because that's what you've got to be seen to be having as a professional sports person. But actually deep down, there are still a lot of self-doubts, there's still a lot of vulnerability that's based around, will I be fit enough to play? Another 3 months out, what am I going to do with my time? Because that is a big issue for professional sportsmen, because all they know is football, cricket, whatever their sport is. When they're actually out on the sidelines, it's actually a dangerous time for players, because, they live and breathe the game. And when they're not involved, they're just scared of what might happen, not playing, things they may get into or things they might end up doing, and all of those sorts of things, and being left in with their own thinking and their own vulnerabilities and lack of confidence. So, there's a number of levels that sort of constitute to confidence, I think, within sport, but it is definitely vulnerable. There's a huge amount of insecurity that's there, whether it's a fitness issue, whether I'm going to play again, or somebody's now taking my place and they're performing. So it's a constant thing. I remember when I finished playing cricket, and every year all we used to do was worry about whether you would get a new contract. So you're fighting for your next contract. And actually what that does is it does create performance anxiety, because you end up trying really, really hard. And actually what you lose is that natural free spirit that you have, that free flowing spirit that just allows you to go out and just express yourself naturally.
See, we've just come to the end of the show. We've got about 20 seconds left. I could go on talking to you guys. A big fan of both of yours, and hats off to both of you. Number one, thank you for coming on the show. And number two, thank you for doing what you're doing. You are our pride and joy. And thank you for being on the show. You've been listening to
Thank
Ramadan
you, Shahid.
Radio.
Thank you.
Thank you, Wasim. Thank you, Zafar.